So we had an unfortunate case of a young man who passed away, and there was a request for postmortem sperm retrieval. And there was a lot of discussion starting at the resident level all the way up to the attending level that made its way to the chief of staff of the hospital. So I thought it might be reasonable to present this case. And we brought in Kinera Pagano from Legal Services, who has some experience with this particular topic to share some of the legal issues. So Richard, why don't you come up and present this?
Morning. All right, so I'll be presenting on postmortem sperm retrieval. I thought it was a really interesting topic, and I hope you find this interesting. So just to start with the case, patient AB, 25-year-old male, status was motor vehicle collision, found pulseless and unresponsive in the field. CPR was initiated, return of spontaneous circulation achieved. No significant prior medical history, prior T10 and 12 fusion, no allergies, no medication. So upon arrival, he had a GCS of 3, intubated, hemodynamically stabilized, and a CT scan showed numerous cranial defects and injuries. Essentially, neurology and neurosurgery evaluated the patient, determined to have no brainstem function, and it was officially pronounced brain dead. The patient was a registered organ donor. And the hemodynamics and his respiratory status was kind of stabilized while the family had some time to come from Florida. Upon arrival, the patient's partner of approximately 10 years had expressed explicit desire for sperm harvesting. She agreed to sole responsibility for ownership over the sperm, and the patient's family had agreed to partner's desire for sperm harvesting. This is why I bring this up, because they had talked to REI, reproductive endocrinology and infertility. They were consulted. STI testing was performed, negative. They discussed with the patient's parents and significant other, the girlfriend, concerning the risk, benefits, and indications for sperm cryopreservation. They reviewed the sperm cryopreservation consent. That basically says explicitly that if the sperm were extracted, its use would be up to the sole discretion of his significant other and the girlfriend, and as to the future use of the sperm, with no decisive capacity on the part of the patient's family or any other relatives as the eventual use and or fate of any retrieved or cryopreserved sperm. That's basically what that consent says. Urology was consulted, and it was, just like Dr. Honig said, it was concluded that no sperm extraction or any similar procedure can be performed without either the explicit consent of the patient in the form of an existing will or an order from an appropriate probate court allowing for the extraction of any sperm or removal of testicular tissue. Furthermore, just the technicalities of it, if an order was issued, any procedure that should be done, there has to be the guarantee that transport of any testicular tissue or extracted sperm can be done quickly. Sent to the sperm physiology lab at the Yale Fertility Center. They have to be open and understand that this is happening, as timing is essential to ensure optimal survival of any sperm. So just to continue the story, the father did pursue legal means for sperm extraction. It was deemed that a court order will only provide custody of the patient's body to the parents without explicit mention regarding custody of sperm to a significant other, which is necessary per the guidelines that I'll kind of go over with you guys. Yale does not currently have any specific policy in place regarding postmortem sperm retrieval. After discussion and involvement of the legal ethics team, REI and urology, the decision was made that the case did not meet the requirements proposed by the guidelines that I'll talk about later, perform the sperm retrieval, namely absence of intent to reproduce, lack of a lifelong partner, and not married. And the patient subsequently underwent organ procurement. Just to give you a quick background, it's a procedure in which spermatozoa are extracted from a human male after being legally pronounced brain dead or being in a vegetative state. Modern assistive reproductive technologies have reinforced the feasibility of posthumous sperm retrieval, and there's been a significant debate over the ethicality and legality of the procedure, as well as the legal rights of the child and surviving parent if the gametes are used for impregnation. A little more history of the first. Successful retrieval of sperm was from a cadaver reported in 1980 in a case involving a 30-year-old man who became brain dead following a motor vehicle accident, and family requested sperm preservation. This one, the vas was removed and flushed with Terodi solution, and the resulting specimen was centrifuged to obtain viable semen, which was then cryopreserved for future use. Terodi solution is just it's like isotonic interstitial fluid that's used in physiological experiments in tissue culture. It basically is just LR with magnesium and a sugar, usually glucose. The first successful conception using sperm retrieved from someone post-mortem was reported in 1998, leading to a successful birth the following year. So gametes have been extracted through a variety of means, including removal of the epididymis, irrigation or aspiration of the vas, and rectal probe electroejaculation. Rectal probe ejaculation is it's carried out under an electroprobe is inserted into the rectum adjacent to the prostate gland, and it just delivers an AC voltage to cause ejaculation. So just to kind of go over the process of what would happen theoretically in the hospital as it's happened. So PSP, I'll just refer to as postmortem sperm retrieval, is generally performed with urgency following death, following decision being made by the grieving parties that it's desirable, local legal considerations must be considered. Medical specialist with the requisite skills to extract sperm from the vas, one of us epididymis or testis, or to perform an orchiectomy has to be here, available, and agree to do it. Following extraction, the sperm or testicular tissue has to be transported to a specialist IVF laboratory where it's processed and frozen for future use. And the possibility of successful conception depends on a multitude of human factors, particularly the viability of the retrieved sperm. And the sperm viability is really dependent on the time interval between the death and the sperm retrieval, and also possibly about the temperature at which the body has been stored. Basically, 24 hours has been suggested as an appropriate time interval during the retrieval that would lead to the most success, up to about 36 hours. So once a decision has been made to use the sperm, it's thawed, injected using ICSI, intracytoplasmic sperm injection, into oocytes retrieved during IVF treatment. And then you have the embryos that are then cultured. So just to go into a little bit of technicalities, this study looked at the time interval from death to a successful procedure. They had 17 consecutive procedures performed in 14 deceased and 3 neurologically brain dead patients at 2 male infertility centers, one in Israel and one at UCSF. The main outcome measurements were retrieval of the vital sperm, pregnancies, and birth. PSR methods included resection of the testis and epididymis, unblock excision of testis, epididymis, and proximal vas, and the vasal irrigation, electroejaculation, and epidydymectomy. They all performed them 75 to 36 hours after death, and sperm was retrieved in all cases and was motile in 14 cases. In 2 cases, testicular and epididymal tissues were cryopreserved without sperm evaluation, and in 1 case, no motility was detected. So their results showed that basically postmortem interval from death, 4 patients had sperm retrieved more than 24 hours after death, and there were 2 cases where it was 30 hours after death, where both resulted in pregnancies and live births. Their conclusion was basically that viable sperm is obtainable well and after the current recommended 24 hours, which I just talked about, and they should be considered up to 36 hours after death following appropriate evaluation. No correlation was found between the cause of death and the chance for successful sperm retrieval. Note. Moving on. So now that you have the sperm, I found some studies to look at what happens afterwards. So this is a case series study from the Australian National University. Looked at data regarding the pregnancy, birth, and long-term childhood health and development. Outcomes regarding posthumous sperm used in vitro fertilization. They reported on 4 women undergoing IVF treatment using post-mortem sperm, acquired sperm from their deceased partners. In all cases, testicular tissue was obtained in a mortuary setting, and the duration from death to the retrieval was from 12 to 48 hours. And the age of the women treated was from 31 to 41. Fertilization rates range from 40% to 100%, but each of the 4 women did achieve a singleton pregnancy. And 1 pregnancy was complicated by preterm birth at 31 weeks. The other 3 delivered at term. And in terms of the children, one baby was growth restricted but morphologically normal. The other children had term birth weights in a normal range, and all 4 children have shown normal and health developmental outcomes with their follow-up about 1 to 7 years. So this is kind of the guidelines that we use during our case over here at Yale. An ethics committee opinions of the American Society for Reproductive Medicine, published in 2018, looking at the posthumous retrieval and use of gametes or embryos. This is kind of what I want you to think about. So the key points. Posthumous gametes retrieval or use for reproductive purposes is ethically justifiable. Written documentation from the deceased authorizing the procedure is available. Retrieval does not commit a center to their later use for reproduction. However, embryo use is also justifiable with such documentation. Second, programs are not ethically obligated to participate in posthumous assisted reproduction. Programs should develop kind of written policies regarding the specific circumstances in which they will or will not participate in such activities. In the absence or written documentation from the program was open to considering requests for posthumous assisted reproduction. Should only do so when such requests are initiated by the surviving spouse or partner. It's very important to also allow adequate time for grieving and counseling prior to and during any assistance with posthumous reproduction. To be continued. Programs should also be aware that state laws vary on whether this posthumously conceived children are legally recognized as offspring of the deceased. State laws also may vary on the permissibility of the process. Clinics should be knowledgeable about follow any applicable state laws and should advise patients that they may wish to seek legal counsel regarding state laws that may affect them and their offspring's legal rights. Okay. Assisted additional kind of ethical considerations should also be considered, including the choices of or interests of the surviving spouse or partner who wants to reproduce during the deceased gametes from the deceased gametes or embryos, and also of others who cared about the deceased, such as surviving parents or any potential offspring, as well as how these interests should be weighed against the interests of the deceased. Okay. So I just wanted to move on to kind of a quote to talk about the ethics about everything. So it may seem that the deceased, and perhaps even those in persistent vegetative states, no longer have any interests, since they cannot feel, think, or experience anything. With the permanent loss of these abilities, how, it may be asked, can they have a stake in anything? How can they be harmed or benefited? This approach presumes an experience-based account of interest, on which people can no longer experience anything because of their deaths, can no longer have interests. In other views, interests may persist after death. One account of these interests locates them in the choices of people while they're living about what will happen in the world after their deaths. People write wills, extract deathbed promises, for example, and thus have interest in these being carried out after their deaths. Another account is that people have critical or legacy interests in the continuation of important commitments and values that they had during their lives. From these views, at least some interests of individuals who have died are ethically significant and should continue to be taken into account after death. However, some ethicists think that the test of explicit consent, which is kind of what we're basing this on, should not even be a necessary condition because it's quite demanding. Men who die suddenly, for example, in accidents, are not likely to have thoughts about giving explicit consent to such a procedure, even though they may have well wanted their partners to have their child under these circumstances. But there may be even some evidence of this. It may be known, for example, that the couple had discussed, having children. So this kind of has led to a number of ethicists to propose another model of consent, implied or inferred consent. The idea that it's enough that the deceased would, on the balance of probabilities, have consented to the procedure, had he had been presented with the relevant facts pre-mortem and been able to discuss the matter with his partner. The problem facing such a test of implied consent, which is displayed here, however, Jones and Gillette point out, is that sometimes that the claim for implied consent to procedure does not imply that anyone had in fact consented, but it's simply the claim that a certain counterfactual fact is true. So the deceased male would have met the condition of informed consent had the matter been put to him. But they're saying it's far from reliable, this kind of theory. Even if the couple were known to be considering IVF, for example, it doesn't tell us anything about the couple's feelings about postmortem sperm extraction and post-humerus fatherhood. Basically, what if the partner stated that the deceased had explicitly said that he would want sperm retrieval after death, and account perhaps that family have corroborated. The problem with this scenario is that the man's partner, as well as the other family members, have their conflict of interest. They have a motivation to hide the truth or put a certain spin on things that the deceased might have said or done, and this doesn't really seem to be reliable. The prevailing legal position and opinion of professional societies is basically, again, this explicit consent. So this is there's kind of this big argument here between these authors and another author that really relies on explicit consent. These authors argue that this is an impractical approach, as the majority of deaths of reproductive age men are sudden and unexpected, thereby precluding explicit consent. They support a move to kind of a standard of presumed consent for posthumous conception, which provisions for men to opt out and safeguards to protect the welfare of the prospective mother and her child. Basically, their view is that when an individual is dead, they no longer have any meaningful interests. That's why I talked about interests beforehand. A man's organs and gametes are useless to him after death, but life-saving or life-creating to others. Their argument is that just like the organs, gametes are a resource that should be considered for use after death. The burden of posthumous conception, legal process and costs, IVF treatment, everything is entirely borne by the mother, not the deceased. As such, donating gametes to a partner is not an easy rescue. It's a zero-cost rescue to the deceased. Given this, the posthumous conception should be, in their view, be facilitated by moving to a standard of presumed consent, not hindered by arguments such as potential infringements of the rights of the deceased. They understand that under this concept, while a minority of men's sperm may be used post-mortem against their will, they think that there's a lesser moral wrong than blocking the wishes of the majority due to a lack of explicit consent, which would have applied to our situation as well. So kind of leading on to the legal side of things, there was a study where they asked about top 75 major academic medical centers, did a ranked, asked in 2016, used U.S. News and World Record using a questionnaire-based telephone web survey. So they gathered data from about 41 out of the 75 major academic centers. Of the 41 institutions, only 11, which is about 26.8%, had policies regarding posthumous sperm retrieval. Out of those 11 centers, 4 required prior written consent, whereas the remaining 6 allowed for verbal or inferred consent from the surviving life partner. One policy prohibited the procedure, and 5 of the policies in the survey included a bereavement period. So I'll show you the data here. Of the 30, 73.2% centers without policies lack basically the number one reason that was cited as the most common barrier to policy adoption was lack of legal guidance. So I think that's why it's important to talk about that next. So this is a list of all the academic centers and the responses. We're at the bottom. No policy. And then the one that does not permit PSR is up there, Northwestern. So next, to talk about kind of the legality of it, we invite Karen Pagano.
Cardiac.
They have to be brain dead, no brain stem, like.
But some of them have already, life support has been withdrawn.
At that, I'm not sure.
So are some of these patients life support has been withdrawn, or are they all just brain dead?
No, some are dead. some are on life support but brain dead, and some are in a vegetative state. So there are three separate categories in terms of patients, but the brain dead and dead would fall into the same dead category. The timing would only be different.
So the dead patient may have been removed from the floor.
Maybe in the morgue.
This may be, so where do you do it? You do it in the morgue? Bring them up to the OR? What do you do with that?
No, you just,
I mean, does the pathologist do it, or does a urologist have to do it?
well, I think you could do it in wherever the body is,
Right.
as long as you're willing to do it. So bring your own
And it's
instruments.
part of an autopsy, for
Yeah.
instance.
It doesn't have to, for the most part, it doesn't have to be sterile per se.
But the viability will rely on the time setting.
Good morning. I'm Canara Pagano. I'm one of the attorneys with the Legal Risk Services Department for Yale New Haven Health System. And I was also one of the attorneys that was consulted as this process was going on. I was handed off the case from the attorney who was on call, who was outside counsel at the time. But I think, as you can tell from the presentation, with regard to the legal landscape, that it's pretty much wide open. There has been no federal law that's been enacted. There's no prohibition against retrieval of gametes from a comatose patient in persistent vegetative state, brain dead, or recently deceased patient. So since the federal government hasn't acted on it, it's left to the states. And as I think you can tell, the states have not exactly taken it on either. And that is especially true here in Connecticut. We don't have a law with regard to posthumous sperm retrieval in patients. So that kind of leaves us to coming up with our own policies and procedures, looking at what other institutions do, looking at how other countries have handled the situation. And when we look at the kind of the legal buckets, as was mentioned, of where these things fall into, the countries that have maybe legislated this have kind of come out on the side of either a complete ban on posthumous sperm retrieval, and we see that in Canada, France, and Germany. There are countries that require written consent, and we see that in the UK and the Netherlands. And then there are the countries that allow for the implied consent, and we see that in Israel, where if the widow should say, you know, he would have consented to this when he was alive, that would be enough for them to go forth with the procedure. So you can see there's a whole range of how liberal or constricted the decision-making is around this. And then with regard to the academic medical centers and how they have come out, as you can see from the table that was presented, they also fall into those kind of same buckets, whether it's banned, requiring written consent, or allowing implied consent. And then who do we get the consent from? Is it strictly from the wife? Is it from a wife and a long-term partner? Are we going to allow parents to consent to posthumous sperm retrieval? And that's what a lot of the ethical opinions revolve around, is who gets to decide what evidence is sufficient. And right now that's left up to the individual medical centers and the providers to kind of come up with that determination. When we talk about consent, you know, when we're dealing with someone who cannot make their own decisions, if they haven't appointed a healthcare representative, we typically default to surrogate decision makers. We usually go in order of priority. So if the individual has a spouse, we look to their spouse to be their decision maker. If they don't have a spouse, we look to see if they have adult children. If they don't have adult children, we would look to their parents. If they don't have parents, we would look to siblings. If they don't have siblings, we would look to any other next of kin kind of down the line. And that's true when we're talking about organ donation. That's requires either the person has designated an agent prior to death, or we look at order of priority going through again those same individuals. And also when we talk about autopsy, consent for an autopsy, that has to be anybody who's 18 years of age or older. They don't necessarily require it go in order of priority. It's whoever is next of kin and wants to consent to the autopsy. But then when we talk about who's going to take custody and control of the body for the purposes of burial, cremation, Connecticut also allows alkaline hydrolysis, which is putting the body in lye and allowing it to decompose, and cryogenic preservation for people who either want to have their full body preserved or maybe their brain preserved in the hopes that technology in the future will allow them to be reanimated in some way. And when we ask, who can obtain custody and control of the body, that is also done in order of priority with the spouse, the parents, adult children, and so on. Unless, of course, the individual has put something in writing, either through a living will, that they want a particular person to have custody and control of their body, and they have given written instructions on what they want done in terms of burial. In that document, they could also include whether or not they would allow gamete retrieval. But as you heard, this is usually people who have the forethought to do something like that, or people who are facing a terminal illness, and it's actually something they've discussed with their spouse or significant other. It's something that they've discussed with their provider, but for the most part, what you're seeing is that, it's young adults who have been in a catastrophic, unexpected accident, such as the young man that we were dealing with here. So we don't have a lot of guidance from the individual or necessarily from the family or loved ones or even from providers. There are some countries that also require that there be, if there isn't explicit written consent, they would look in the medical record to see if there was any kind of a statement in the medical record as to whether or not they would want posthumous sperm use, and it hasn't been attested to by a medical provider, and that might be sufficient to allow for consent for the procedure to go forward. Now, I'm not going to say that, sure.
If you can somehow know what someone's practices were before their death, let's say they were actively trying to get pregnant, does that make a difference compared to someone who may have been using birth control ahead of time? Because it's not necessarily, I think it'd be easier if they were actively trying to get pregnant to understand that that was something that they desired, as opposed to, to me, it wouldn't matter at all if someone was using barrier protection or something first, because in the future they may have wanted to have children, right?
No, and that's exactly what a lot of the ethical opinions focus on, is were they actively trying to conceive? Were they maybe going through IVF therapy? Had they recently stopped using birth control and had talked about having a family, that kind of thing? All of those bits and pieces of evidence do come into play in making the decision. I think, what the real struggle has been is that it is just such a kind of a hodgepodge and a mix of where do you come down? Do you require the explicit writing, which a lot of people just don't give a particular thought to at a given stage, or would you allow the implied consent?
Is there the same degree of nebulousness in posthumous egg retrieval?
So some people treat them the same, that you would go through the same process, but they recognize that retrieving the egg from the female is much more difficult in terms of just the procedural aspect. There are some ethical opinions out there that do talk about the sensitivity around retrieval of a female's eggs, the use of those after her death, the importance of motherhood to the woman. So there's a lot of, I think, cultural and religious aspects also to that. But for the most part, I've seen in the opinions that I have read, they advocate for treating them the same. But I will say, it's not that Connecticut hasn't given some thought to it, because they have. There is actually a law on the books that talks about the property rights of children born after death. And this particular law requires that for Posthumous use, it must be in writing. They specifically provide that the spouse has the authority to exercise the use, the retrieval and the use of the sperm or the egg posthumously. They use the word gametes, so they are talking about both an egg or a sperm. The writing has to be signed by both the spouse and the decedent before death. And then the child has to be posthumously conceived not later than 1 year. So when you look at the policy that Weill Cornell has put in place, they require that the request has, the authorization has to be in writing, has to come from the spouse, and then they put a 1-year moratorium on the use of the sperm. And they require during that 1 year that the wife go through, psychological and grief counseling. So having a 1-year moratorium in Connecticut would have a serious impact on the ability of a posthumously born child to inherit from the father. So they put the 1-year limitation on that because they want to have some finality to these types of situations. So, obviously there must not be the same issue in New York. There are no laws on the books that I'm aware of in New York. I think a lot of the hospitals in New York State, in the area, do follow some of the guidelines that have been put out by Weill Cornell.
Can you talk about some precedent or landmark cases regarding this issue in Connecticut or other states that have come up?
So there aren't any really in Connecticut. There are no cases that we found that went up to like the appellate court. There was a case in California that allowed the significant other to posthumously retrieve the sperm of her significant other based on the Uniform Anatomical Gift Act. They determined that sperm was actually tissue under the act, and therefore she could consent to the donation of the sperm. When we talk about organ donation, we're talking about it in terms of, transplantation and research, and maybe beneficial use. They determined that the use of the sperm was more of a beneficial use for another person, as opposed to, trying to put it into some other category. But there are very few cases. A lot of these cases do end up in probate court. Probate court opinions are not published. So a lot of times you might find out that there was a case that went to the probate court, and all that you have is that, either they did or did not do the retrieval, which is kind of what happened in our case. The family did go to the probate court. They submitted a petition for the custody of the body because he was brain dead. In their petition, they did include a request for an order authorizing the retrieval of sperm. The probate court issued an order, and all their order said was, we give custody and control of the body to, and I believe it was to his parents, but it did not make any mention of the retrieval of the sperm. And it's not clear why that is the case. I've talked with other attorneys, and we wonder if it's because the individual was brain dead, and therefore dead under the laws of the state. There really isn't anything else that the probate court could do other than give custody and control of the body. They couldn't give any other orders. That's maybe one thought. It could also be that since we weren't there, we don't know what the arguments were before the court. Did they overlook it? Did they not understand what was being asked of them? So that's kind of the situation that occurred with this particular case. Yes.
So just a couple of points. Number one, no one in this room is ethically required to do this if it's against what they want to do. So if you were on call and you were faced with this and you felt that there was an ethical reason why you did not want to do this case, this is no different than doing a termination or anything else, you don't have to do the procedure, number one. Technically, it's very simple. You can just do an orchiectomy, you can take a piece of tissue, you can pass it off. Number three, you have to have a team that will accept the samples. So the sperm lab will have its own guidelines as to who it may or may not take specimens from. The only situation where I think you absolutely would want to move forward if you were ethically okay with it is when there is written documentation that the patient would want to have his sperm retrieved posthumously after death, if he had passed away. And it's rare, if ever, that you see that. And what we're usually faced with is this kind of inferred concept, as Pat was mentioning. What do you do? If the patient is saying, well, I was with my wife and I were, or if the wife is saying we were trying to get pregnant, there's always this kind of somewhat conflict of interest, as you don't really know whether they're telling the truth or not. Okay, but you have to kind of make that leap of faith as to whether you're comfortable with doing something like that or not. There's nothing that says you have to do it, but you can make an argument. Well, what if she was pregnant when didn't know it at the time that he passed away? How is that different than this particular scenario? What if she was pregnant? Would you kind of think of those situations? I guess there's a higher power weighing in here.
Your answer.
So it's pretty complicated, but I would just say that anyone in this room does not have to feel obligated that they have to do the procedure.
So I will say,
Probably not.
yeah, the Catholic Church
I would say that
does
you'd
not.
have to transfer the patient.
I would.
The other thing to highlight is that, as Richard said over and over again, is that all of these sperm retrievals have been shown to be effective within 24 hours and up to 36. So this is not an emergency. You have time. You can think about it, talk to your colleagues, talk to an ethics committee, talk to the head of the hospital. You don't have to run in at 2 a.m. and do it because the sperm is still viable.
Right. So, and I did see one opinion that talked about whether or not it was an emergency, and I do believe they came down on the side that it wasn't technically an emergency, that you did have time to do it. And I do think, as you said, getting the ethics committee involved is very helpful.
Yeah, this is just a sort of situation you don't want to be the only physician making a decision in, right?
Correct.
The other thing I want to highlight is from the ethical perspective. Every scenario we've put forward so far has been with a willing partner who is eager to have, who wants this sperm. So it's like, a wife, a girlfriend, whatever, that is eager to have, this done. However, even in these cases where there's writing, where there's a legal consent saying, I would like my sperm retrieved after death, there is an ethical concern about the implications for that partner. Does the partner is she now obliged to take that sperm to deliver said child? There can cause significant psychological stress on a woman or a partner, which I think has to be very carefully nuanced. And so I think that's why it's really important to that the Cornell guidelines, the Weill Cornell guidelines are kind of thought about, is that there is a lot of discussion before implantation, because an adjustment disorder, loss of a loved one is a huge issue, and making a rash, permanent decision is something that should not be done lightly. So just kind of that's another kind of side of things that should be addressed. Because sometimes it's the parents that want the sperm retrieved, not the wife, despite what it says on the writing, et cetera, et cetera. So it's a very, very convoluted area.
No, it is very convoluted, and I think the ASRM guidelines, address the issue of when the parents are the ones that are asking for it, and they explicitly state that it should not be agreed to if it's coming from anyone other than a spouse or a long-term partner.
organ donation. If you want, if it seems the simplest case is when there's consent. So you could put on the license. You ask whether you want to be an organ donor. You could ask if you want a posthumous sperm donation.
Right. Well, I mean, I think it also.
Or on our living wills or whatever. I mean,
Right.
someone needs to ask.
Right. Exactly. Yes.
Child, let's just say they do have posthumous sperm retrieval and the child comes out, are they given the benefits as related to the father that had passed away?
Right, and that's primarily why there are some laws in states, and I think that's, goes exactly to what Connecticut has done, and that is in order to give the child not only the rights of inheritance, but also Social Security benefits, because it has an impact on that. So that's exactly why the states have legislated that particular piece, but they haven't legislated everything that comes before it.
I think we're going to be working to set a policy at Yale so we can kind of streamline this as things move forward in the future. Thanks very much.
Thank you.